I'm Fonzo.
And I'm Eliza.
And we're the co-host of Grown, a podcast from the Moth that shows we're never fully grown.
Growing up feels like a phase that should end at some point, but does it ever really? Whether you're 16 or 26 or 86, you're gonna have to deal with family drama, your body, and the type of person you want to be. So why not put it all out in the open and go through it together?
Join us every other week to deal with cringe, culture, and the courageous efforts of people like you to get grown.
Start listening today. Follow Grown on Apple Podcasts, Spotify, or wherever you're listening right now.
Ignorance is bliss, until it isn't. For most of my digital life, I've had a pretty laissez-faire attitude toward online privacy. I don't have a secret Swiss bank account or intel the CIA cares about, so if someone out there is watching me, it's no big deal, right? Not so much. As I've learned in the past few years, just because I don't have anything to hide doesn't mean I have nothing to lose. If a quick Google search can give you all of my past addresses, it may be easier to make your way into my bank account. If I use the same password for everything, you can take over all my social media accounts in one fell swoop. In the past few months since the overturn of Roe v. Wade, I've been reading a lot about what's at stake when our personal health information is easy to access. And if I wasn't already convinced that the hassle of two-factor authentication is worth it, I am now. This is Embodied. I'm Anita Rao. Think pieces and in-depth reporting about protecting and managing health information have been flooding my news feeds. While some of it has been helpful, I'm also a little confused and could use some guidance about where to focus and how to not panic. So I called in an expert.
So we can actually use data about what digital evidence has been used to criminalize abortion in the past to help us understand where we need to prioritize our efforts now.
That's Amanda Bennett. She's a project manager with the Digital Defense Fund, an organization providing digital security and technology support to the abortion access movement. The Digital Defense Fund has been at this work since 2017 and has put in a lot of research to understand what personal information we need to protect in digital spaces and when it could be used against us.
So there's some great research. There's a report called Self-Care Criminalized by If When How, and a paper called Surveilling the Abortion Diary by Cynthia Conti-Cook. And what they have found is that in the past cases where people have been criminalized for pregnancy loss, the pregnancy loss is reported to the state, usually by a healthcare provider or an acquaintance who finds that pregnancy loss suspicious. So that suspicion is often rooted in racial and class bias. And then after the pregnancy loss has been reported, an investigation begins and digital evidence is used as part of that investigation. And so far, what we've seen being used is things like Google searches, so browser history, text messages, emails. Police often get this evidence via a so-called consent search of a phone. Whether someone can truly consent when they're in a tense situation with a police officer is questionable. But once the police get that phone, they use forensic evidence tools to extract all the data, and then they can search for keywords that would help prove intent. So they're trying to prove that the pregnancy loss was an induced abortion.
The first big lesson in digital security actually has less to do with your devices. It's be careful who you share your personal information with. Law enforcement, at least at this point, isn't regularly trying to access your DMs to search for wrongdoing. Someone has to tip them off. So Amanda says make sure you keep your circle small when it comes to sharing sensitive information, and ensure that you trust the folks who are on the receiving end, whether it's an acquaintance or a healthcare provider.
If healthcare providers suspect that a crime has occurred, then HIPAA doesn't protect information that could be evidence in a court case. For example, if a provider suspects that that person is using drugs, they can report that to social services. And we're seeing the same thing with abortion. So far, no state requires healthcare professionals to report a suspected abortion, but we're living in this extreme environment of fear where healthcare providers are potentially worried about losing their jobs. They think that they have to report, or there also are healthcare providers who are anti-abortion and want to take advantage of the environment to punish people for potentially having an abortion.
According to the report Amanda's been talking about from the legal advocacy group If, When, How, between 2000 and 2020, 61 people were criminally investigated or arrested for self-managing an abortion or helping someone else. Those investigations ostracize folks from their communities and sometimes cost them their jobs, even if they didn't end in a trial or jail time. The majority of the cases involved abortion medication, that 2-pill regimen you've been hearing about a lot. It's safe and effective in cases of pregnancy up to 11 weeks and accounts for more than half of all abortions done in this country. In the wake of the overturn of Roe v. Wade, the legality of using these pills if you're in a state where abortion is restricted has gotten complicated. The Digital Defense Fund has some safety recommendations.
The first thing that folks should think about and be aware of is what are the laws in their state, and then digital security tactics like securing your communications. That looks like using an end-to-end encrypted messaging app like Signal with disappearing messages turned on, securing your device. So that means having a PIN or a passcode on your phone and encrypting your device, and then securing your browsing. So that could be reactive things like deleting your browser history, or proactive things like using a privacy-focused browser called Tor, or even just using something like Firefox Focus. And in addition to digital security tactics, it's important to keep in mind operational security tactics. So things like learning about your rights when interacting with police and how to assert your right to remain silent, and being careful about who you invite into your abortion experience with you.
If you're listening and starting to get overwhelmed, don't worry. I was right there with you in getting ready for the show. And after opening 1 million private browsing tabs, I decided to step away from the computer and take a pause. When I came back to it, I did what Amanda and the Digital Defense Fund call threat modeling. It's putting your individual risk into perspective and looking at patterns in the past that could inform what your experience might be in the future.
The digital security and privacy world is so big. There's so many things that can be really overwhelming. And so it helps us think about what is most likely to happen in our situation and where we can choose tools to protect ourselves based on that. And so a lot of threat modeling is based on looking at what has happened before. So that's why I've been talking so much about this report about past cases of abortion criminalization, because what predicts the future the best is what has already happened in the past. And then there's other things to take into account, like people's identity. So we know that the carceral state affects people differently in the United States. Black and brown communities are disproportionately affected. And so different aspects of people identity that affect how they interact with the state and with state surveillance can also affect how they might be affected by abortion criminalization as well.
So one of the things that I haven't heard you mention is period and fertility tracking apps and the importance of being really careful about how you use those. Tell me about your thoughts on those and maybe why you aren't as concerned with how this factors into the conversation.
In all the cases we've seen so far, the pregnancy itself hasn't been the legal issue. So there isn't a need for data that proves that someone was pregnant, right? And period app data or a credit card receipt from buying a pregnancy test, that would help establish that someone was pregnant, but that hasn't been the legal question in the cases so far. The technical kind of medical term for miscarriage is actually spontaneous abortion. And so spontaneous abortion or miscarriage and induced abortion can present the same. And so that's how someone can show up with a pregnancy loss, and people can be suspicious about whether it was induced or spontaneous. So menstrual tracking is actually more important than ever, I think. Fertility awareness is a really powerful tool in reproductive autonomy. So if tracking your period is useful to you, you definitely don't have to stop using your period app. But as a privacy person, I would encourage people to look into the privacy policies of the app they're using, not necessarily because of criminalization, but just to protect their period data from, the exploitative data mining economy. And so a couple of apps that store data locally are Yuki, it's spelled EUKI, and Drip. But I'm recommending those, as just a general advocate for privacy.
I want to note here that it's not just abortion seekers who benefit from an online safety plan. Those who assist others in finding and receiving abortions are also vulnerable online. You may have heard about the case involving a mother and daughter in Nebraska. Last month, the mom was charged with 2 felonies related to helping her teenage daughter abort a pregnancy after 20 weeks, which is illegal in Nebraska. A key piece of evidence, her Facebook messages.
We're in an era where increasingly more and more of our data is being mined by these large companies and is being used in legal cases against us. So I've definitely personally increased my vigilance around the kind of tools I'm using to communicate both with clients and with other reproductive justice activists.
That's Kestrel, an abortion doula and member of the Mountain Area Abortion Doula Collective in Western North Carolina. They're using a pseudonym in this conversation for their safety, which is just one of the precautions they've taken since getting trained as a doula.
The trainings themselves that I attended required a level of vouching to participate in, which I think is a really important piece of security culture that maybe transcends simply like utilizing different technological steps to protect our information, but actually using the strength of our relationships.
Establishing trust got Kestrel in the door and laid the foundation for their security. But from there, Kestrel and the doula collective they're a part of had to take many of those technological steps we started to talk about earlier.
You know, I've personally been fairly vigilant about only using Signal for a long time to communicate. Just in general, even when nothing I'm communicating is necessarily information that would be criminalized. I think it's a good practice and habit. One thing that I've started doing and we've started doing as a collective is starting to use phones that are specifically for communicating amongst the collective that folks pay for in cash and are not associated with anyone's name or address, and we don't turn on in the presence of their other phones, because that's really one of the most secure ways to maintain communication with each other.
So, Amanda, I mean, we have been discussing individual privacy, but Kestrel is bringing up these notes about what organizations are doing at an organizational level. And I'm curious about some of the work that you have done with organizations, abortion access organizations, abortion funds, and what the primary technology needs are that you've identified for these groups.
Yeah, so all individuals, small businesses, and nonprofits are vulnerable to financially motivated cybercrime. So that's something we talk about with all the groups we work with. It's not just ideologically motivated online attacks, it's also the same kind of scams and phishing and hacking that any person or business online might deal with. And then in addition to that, abortion advocates have high rates of online harassment. So online privacy is a big issue that we talk about. And then, like Kestrel mentioned, this risk of state surveillance that calls for other tactics like compartmentalization and using end-to-end encrypted technology. Ultimately, we try to help our clients understand the basics of technology, privacy, and security so they can navigate a rapidly changing landscape of both abortion access and online cybercrime. So we tend to focus on account security. I think we've all had a friend whose Instagram or Facebook or email has been hacked. This is often because of using the same password on more than one website, and cybercriminals are always working really hard to breach websites and steal their list of usernames and passwords so they can try to use those same usernames and passwords on other sites. So to protect against that, we recommend that folks use long, unique passwords for every account and use secure end-to-end encrypted password managers to manage those, turning on two-factor authentication, and then, of course, being aware of phishing and scams, which is really challenging because the people who develop scams are constantly innovating. Searching yourself on Google to see what someone might find if they start looking for you, just being aware of what someone sees if they look at your social media accounts and what a photo can give away. And then also things like compartmentalization and encryption. So choosing to use end-to-end encryption, things like the Signal messaging app. And what end-to-end encryption means is that even when your messages are on Signal's servers, Signal can't decrypt them. So every company has to respond to valid legal requests. But when you use a company like Signal that has end-to-end encryption, they don't have anything that they're able to turn over.
So you mentioned kind of searching yourself online to figure out kind of how much information is out there. And I saw that as one of the things on your all's resource guide. And I did it, and I was floored by the amount of information that was out there about me. The fact that, any address that I had ever lived was relatively accessible. So, I encourage everyone to go through this process and just kind of become aware, but I'm also curious about kind of the most important things to try to keep private if you're worried about that online harassment or that doxing piece, which may be a concern for people who are abortion storytellers who talk openly about their abortion story, or people who are working as volunteers or supporters like Kestrel.
Yeah, so the goal is going to be making it as hard as possible to find your personal address and your phone number. So the top thing we recommend first is submitting opt-out requests to all of the data broker sites. So when you Google yourself and those websites come up that have lists of your addresses, you can actually opt out of all of those websites. It's just really tedious because every site has a different opt-out link. So we have on our website links to a couple of workbooks that kind of put together all of those opt-out requests. In our trainings, we suggest that people host super fun privacy opt-out parties where you can get people together and just go through those workbooks while you're all hanging out, because it is a very tedious process. But doing that can make it so that when you Google your name, your address doesn't pop up right away. And that'll make it a lot harder for someone to, find that personal information. And then also really just being aware of what the settings are on your social media accounts. And if you do have a public account or a professional presence, making sure you have rules for yourself about what you don't post. So for example, not posting a picture of your house, because people who are skilled at open source intelligence can take a photo of a house and use tools like Google Street View to figure out where it is.
That is very helpful. Kestrel, I'm curious about what Amanda is saying resonates with you. Obviously you're using a pseudonym in this conversation, but what are some of the other practices that you do regularly to protect yourself from doxing and digital harassment?
Absolutely. Yeah. I think trying to keep a secure media presence is really vital to our survival organizationally and to our own personal security from state surveillance and state repression. What can be really difficult, though, and I think in our work, there's this constant tension between maintaining secure methods of communication with clients, encouraging clients to use the same encryption that we're using, encouraging them to use Proton Mail, and the realities of needing to reach people who often don't have general access to digital technology or even generally have access to phones all the time. We're doing work in a very rural area where folks' resources are inconsistent. And there's a level at which we need to assume a minor level of risk just so that people know that we exist and that we're a resource in the community. But something that I definitely do is I don't have any public social media associated with my legal name. I don't use unencrypted text messaging for anything ever. And when I'm communicating specifically about criminalized abortion support, I use a separate phone that's not ever been associated with my name. And I think another piece of this too is how do we actually actively form networks of care and support, which are essential to the craft of dueling, if and when we do become targets of the state, because this is just it's an inevitability for a lot of us, especially when we're doing intimate work in these small communities where it becomes very difficult to not be known publicly after a certain period of time. So how are we showing up for each other? How are we protecting each other?
I love that Kestrel and their team are thinking and talking about the community care piece of digital security, because it's something I think about a lot when I hear other femme folks in journalism talking about their experiences getting doxxed, trolled, or harassed online. It can be brutal out there and lonely. We've been talking a lot about how to take care of yourself and manage your own digital privacy, but how about government protections? Well, there's no comprehensive federal law about privacy. Laws dictating rights of companies to share, store, and use your data are different state by state. In June, U.S. senators introduced the My Body, My Data Act to Congress. It's a bill designed to protect reproductive and sexual health information with some limitations. Where this will go and what state leaders are going to do about it is still very much up in the air. For abortion access organizations, the shifting landscape of restrictions and protections is a lot to keep track of.
Yeah, it is really overwhelming. And I think what we're trying to do is, because North Carolina is a destination state for abortion right now, we've been really focused on figuring out how we can support folks living across these false colonial state borders in Tennessee, across the mountains from us, especially where, from my understanding, there's a lot of legislation being proposed to deeply criminalize accessing abortion pills by mail right now, and abortion is a total ban is in effect. And we do have someone in our collective who's currently in law school and keeps abreast of a lot of these shifts in legislation. One ethos that is really central to me in this work and in the justice work I engage in general is that any right the state can give, the state can take away. And so I think trying to operate from a standpoint that we need to be prepared for whatever legal consequences might happen and offering solutions that exist outside of legal frameworks is really central to this work.
As we're kind of moving into an uncertain future where the things could change and there are ongoing unknowns, how are you balancing precaution and preparedness with paranoia and not wanting to live in that state of fear?
Yeah, I mean, I think that that's an essential question for organizers. And I think part of some of the intentions of this kind of surveillance and this criminalization of our data and our records is to sow seeds of distrust and paranoia in community. That's successfully what the US government has a history of doing particularly with Black-led radical formations in the US. And so I think what I seek to do personally, and I think what our collective seeks to do, is invest as much time in building trusting relationships and community and focus as much time and energy on building those networks of deep mutual commitment to shared struggle for body sovereignty as we do spend on protecting ourselves and securing our communications. We want to spend on developing and nourishing those relationships, because those relationships are also ultimately what protect us. That's sort of the attitude that I've tried to use. And also, a lot of it is like the serenity prayer. Like we have to accept what we can't control at a certain point. And I try as much as I can to remove digital communications from how I'm connecting with people at all. And I think that that's something that's given me a lot of serenity, is just trying to create as many spaces for face-to-face, phoneless communication, which actually I think does build up deeper trust. And in the realm of doula work allows for some of that, like really essential moments of vulnerability that we need to do this work well. So I've appreciated trying to focus more energy on in-person connections.
If you're listening and wondering how we got here to a moment in which concerns abound about the surveillance of personal health data and abortion information, it's a good time to listen to the stories of sex workers. Laws intended to curb sex trafficking put many sex workers in the crosshairs of digital surveillance and push them out of platforms and online spheres they relied on for their work and safety. Dr. Olivia Snow is a writer, dominatrix, and professor, and someone who's written about the parallels between online safety for sex work and abortion access. She published a piece right after the overturn of Roe v. Wade, in which she called sex workers the canaries in the coal mine for digital surveillance.
Tech companies pretty consistent, and the state pretty consistently use sex workers as a test population for novel technologies. And the reason that we are excellent guinea pigs is because nobody cares what happens to us on the whole. People don't listen to us. People are not invested in protecting us. So big tech is then able to fine-tune various technologies that it can then roll out to other populations and especially other marginalized demographics.
Like abortion, the legality of different types of sex work varies by state and even by city. But since 2018, the internet, apps, and digital spaces have become especially restricted for anyone engaging in sex work because of a series of laws known as FOSTA SESTA. I'll throw it back to Amanda Bennett to explain.
How to explain it briefly. It's a complicated bill, just like abortion access bills can get really complicated. But because of FOSTA SESTA, it became really hard for sex workers to communicate online. Corporate tech platforms like Facebook and Tumblr and Craigslist, they all started removing access to just like talking about sex on their platforms. And so learning how sex workers have really taken control of their online presence in the face of something like FOSTA SESTA is really informative about how you can kind of cultivate your own audience and your own network and using the internet to connect with other people while keeping those connections kind of under your own control rather than relying on an app like Facebook or Instagram.
Organizations like Amanda's learn from the activism and actions of sex workers because they've been big targets online for a while. Olivia said while FOSTA SESTA made her more of a target online, she experienced a lot of harassment and challenges long before the bill was introduced. So she's had a lot of time to figure out some strategies for being a part of online social communities, though it's complicated.
I mean, I started doing sex work over 15 years ago, and I had experiences in the mid 2000s where I was getting outed online. I feel like I've kind of worked backwards to identify things that doxers might use to find us. Things that I don't share or that before I got doxed, I didn't share would be location, in that I would say I was in the United States. I would not say what city, what state. I wouldn't say what time zone. If I uploaded a photo, I would remove all of the timestamps. I didn't say whether I taught at a public or a private university. I didn't say where I grew up. I didn't say my ethnicity. I never showed my natural hair. Trans women especially have taught me a lot of what I can and cannot share, because they too have faced a similar level, not so much of tech surveillance, but of just public antipathy. But someone with endless time and resources is still going to be able to find you.
So what keeps you, this sounds like so much psychological labor and emotional labor. And
it sucks.
It takes such a big toll. Yeah. And I'm curious about, I guess, what makes you continue to do it and want to talk publicly about it as well.
Well, so on one hand, some of these precautions I take are just second nature at this point. I have to stop myself from not redacting timestamps from screenshots now. I'm just, it's just autopilot. But with sex workers specifically, there really is no other community, at least online. They're to stop speaking or to stop engaging in this would be a form of social death almost. And, I am in a very privileged position. I'm a white cisgendered woman with a doctorate. If anyone's going to put their neck on the line, might as well be someone with, really thick skin and, the privilege to protect me from some of the violence that, say my trans women colleagues might not be able to avoid. So that's, one of the primary reasons that I keep it up. But also, sex work isn't going away anytime soon. That's another misconception, I suppose, about laws like FOSTA SESTA that, purport to end the sex industry. That's not going to it's not going to happen. Ditto with abortions. Abortions aren't going anywhere. So, it's work that, while taxing, has very immediate material impacts on the most marginalized around us. And that, that really eclipses what might be the, extra $300 I spend in therapy per month.
Well, I'd love to close with you about that question of kind of balancing privacy with paranoia that I asked Kestrel earlier on, and how you are navigating that in this moment.
So I have found, especially as someone who already took major precautions and still got doxxed anyway, it's not paranoia. It isn't. I think that rather than equivocating over whether it makes sense to do all this or if it's actually helping, I think it's more important to make sure you just don't become consumed with that fear.
Yeah.
There are practices that you can take, but ruminating on them isn't going to make them any safer. It's just going to freak you out. So the psychological labor, I think is how you put it, minimizing that as much as possible, not trying to theorize like, oh, did this work? Am I still safe? Like, I don't know. We don't know. But, we keep moving forward. Like, it's not safe work to do, but we need to do it anyway.
Embodied is a production of North Carolina Public Radio WUNC, a listener-supported station. If you want to lend your support to this podcast and WUNC's other shows on demand, consider a contribution at WUNC.org now. Incredible storytelling like you hear on Embodied is only possible because of listeners like you. This episode was produced by Kaya Finlay and edited by Amanda Magnus. Jenny Lawson is our sound engineer, and Quilla wrote our theme music. If you enjoyed this episode, share about it on social media and tag us with the handle @EmbodiedWUNC. Hearing about your responses to this show means so much to us, and it really helps new folks find the content as well. Until next time, I'm Anita Rao, taking on the taboo with you.